Hello everyone, I am Dr. Nishar, consultant plastic surgeon. This is part 2 video about lipedema. In this video, I am going to discuss about the management of lipedema. The management of lipedema differs from individual to individual depending upon the stage of the lipedema and also the type of the lipedema. Along with that, different age group has different problems. So, the management also varies depending upon the age of the patient. For example, if the patient is in early 30s or 20s, they are more bothered about the appearance because they have early stages of lipedema, they don't feel heaviness or pain and there is no problem with their mobility. So they are more worried about the appearance, like they can't able to wear the proper dress. For them, the treatment is different. For those who are in late 30s or 40s or 50s who progress to stage 2, they have difficulty in mobility, they have pain, bruises and other associated joint problems. So the treatment and management of lipedema differs in this group. Not every patient requires surgery. Even if the surgery is planned, the patient will be put in medical management or conservative management for initial 4 to 5 months to prepare the patient for the surgery. So what are the treatments available? So it can be divided into medical management or conservative management and surgical treatment. Medical management or conservative treatment involves lifestyle modifications like diet and exercises, lymphatic massage therapy, compression garments, and there are other medical therapies like red light therapy which are emerging thing, and there are certain research going on currently which shows the role of weight loss medications like Mounjaro in the treatment of lipedema. So we always say that diet and exercise will not reduce the stubborn fat deposition in the lower body and arms, but the diet and exercise plays a crucial role in decreasing the inflammation of your body, as we already told that lipedema is an inflammatory condition. But when we look into the researchers, there is no particular diet which helps in treating the lipedema, because some patient responds to and behave well to certain kind of diet, some patient does not tolerate that diet. So we don't need to stick to one particular diet which all recommends. Whichever the diet protocol suits you, you can take it. For example, the research says that lipedema can be well managed by taking the keto diet, Mediterranean diet and anti-inflammatory diets or low carb diets. When you look at these diets, the most of the thing has carbohydrate which is less than 50 grams. For example, in keto diet, it is low carb, moderate protein and high fatty diet. So this is the keto diet. What they say, your body doesn't take much carbohydrate. All the food which you are taking is more contains the fat. So our body over the course of the time uses fat as an energy. At the same time, it turns the abnormal fatty deposition in our body also to meal. So that's how the keto diet works. But what happens is, over the course of the time, our body turns into ketosis. So some people won't tolerate that ketosis and they stop the course of the diet. Then again they will start binge eating. So that's why whatever the diet suits you, you follow it. So this is regarding the diet. And regarding the exercises, initially if they are overweight or if they are in stage 2, stage 3 or if the patient is in 40s or 50s, it is difficult for them to walk for a longer duration, and to do exercise also it's cumbersome for them because of the joint involvement. But light exercise like walking, other cardio workouts, especially aquatic exercise, what they claim like swimming or walking in the water in the swimming pool, may help you to increases the lymphatic circulation. This lipedema is not only about the fat, there is a involvement of the lymphatic system, and abnormal lymphatic fluid collection also occurs in the lower limb. So when you do aquatic exercises or swimming, what happens? Because the water exerts some pressure, it helps to improve the lymphatic circulation. Second, inside the water you feel very light compared to your weight, so the mobility is also easy. So they advise aquatic exercises and little bit of walking and strength training. So strength training plays a vital role in treatment of lipedema if you are in 20s or 30s, because in lipedema, because of this fatty deposition, our muscle also go in for atrophy. So you need to strengthen your muscles. So this is about the diet and exercises. Then comes the lymphatic massage therapy. What happens is, there is a trained lymphatic massage therapist who does this. There is abnormal fluid deposition. Not everyone needs lymphatic massage therapy, but invariably most of them have the lymphatics involved. So when they start doing the lymphatic massage therapy, their mobility is improved, their circumference also might get changes, and the pain also get decreased. So they have to constantly use massage therapy for longer duration, because this is not a cure, and there is no cure for this lipedema. This is a chronic and progressive condition. You need to maintain the current situation, not to progress for a longer time. So lymphatic massage therapy helps. Next thing is compression stockings. Compression stocking is nothing but a tight innerwears which you have to wear from hip to leg, and if arm is involved, you have to wear for the arms also. When you use these compression stockings, it exerts an amount of pressure. This displaces the collected lymphatic fluids into our circulation. So when the lymphatic fluid is pumped into a circulation, it helps to decreases the circumference of the lipedematous area, and sometimes lymphatic fluid plays an important role in giving nutrition to this abnormal fat. So the removal of lymphatic fluid from our body into the circulation is crucial. That's why the compression stockings are advised. This stocking they have to use for a lifelong time if possible. So another recent advances are red light therapy and weight loss medications. What red light therapy does is, it provides light in a wavelength of 670 nanometer. When we project a light into the affected region, the light penetrates deeply, and the problem is abnormal collagen deposition. So this red light makes the collagen deposition in a proper way. Then there is impaired blood circulation. It improves the blood circulation. At the same time, it decreases the overall inflammation of that particular region. This is how the red light therapy works. So will the red light therapy alone is the treatment? No, it is an adjunct to treatment whichever I mentioned above. So it is one of the recent advancement in the treatment of lipedema. Then comes the weight loss medications like Mounjaro. There are researches still going on which says Mounjaro injections, apart from treating obesity, plays a vital role in other systemic involvements like decreasing the inflammation. It also helps in treating the heart and renal problems. So we use that part as an off-label treatment in the lipedema. In lipedema, the body has inflammation. So when we give this weight loss medications, the overall obesity is also getting decreased. At the same time, inflammation of the body is also decreased. You can ask me, like, how do you diagnose lipedema? Whether we need to take any blood test or any ultrasound scan. There is no proven diagnostic to diagnose the lipedema. For example, there is no blood test or there is no radiological investigations like ultrasound or CT and MRI to prove there is lipedema. If I say that there is inflammation in the body, whether will it be shown in the blood test? No, it won't be shown in the blood test. For example, we say that this lipedema is due to hormonal imbalance like estrogen imbalance and inflammation. If you take blood test to check for the abnormal estrogen levels or abnormal inflammatory markers, there won't be any change in the blood parameters. Your hormone level will be normal, your inflammatory markers will also be normal, because everything happens at the tissue level, which is not reflected in your blood parameters. That's why this lipedema condition is misdiagnosed and misinterpreted as obesity, and the patient is not getting any proper treatment. So the diagnosis which we mentioned is a key in management of lipedema, and the management of lipedema also involves the medical management. When coming to the surgical treatment, it is the liposuction. We remove the abnormal fat depositions in the thigh, buttock region, and sometimes the leg, and also in the arm. But the difference in liposuction for the cosmetic purpose and lipedema purpose is different. For example, in patients with younger age group, they want more contour, but in little elder people, they want mobility. But the lipedema's tissue behaves very differently. It does not look like the normal fat. Normal fat is very soft, but lipedema fat is little firmer. So it is difficult for us to remove the fat also. So there is a difference in fat between the obesity and lipedema. In obesity, the fat is softer, But in lipedema, the fat is little firmer and it is surrounded by the strong collagenous structure. So the surgery is indicated for those who has failed the medical treatment, who wants the desired shape to their body, and they feel there is a heaviness and mobility restriction. For them, we advise the surgical treatment. And even in younger people who wants the body contouring, especially in lipedema, we initially advise them to go for the conservative or medical treatment for the 3 to 4 months to prepare their body to decrease the inflammation, to improve the lymphatic function. Then we take them to the surgery. So that's how the treatment of lipedema goes. So if any of you feel that if you have lipedema, whichever we have mentioned in the part 1 and part 2 videos, if any of you feel that you have the features of lipedema, self-examine yourself, whatever we said. So if you feel that you have these symptoms, go meet your doctor and diagnose yourself that whether it is lipedema and get an early treatment, because there is no cure for lipedema. Early treatment prevents the progression of the disease to the advanced stage.